We are going to record this webinar and welcome this afternoon to a very exciting webinar presentation. We are so happy after a very long waiting period to be able to share the news that USDA has put forward its proposed rule on the WIC food packages. This has been a long time coming. Many of us have been raising specific concerns about the food packages for years. Many of us have, of course, elevated these concerns to USDA and advocated for this process to move forward. I'd like to particularly thank Shannon Whaley and the other members of the National Academies of Sciences, Engineering, and Medicine panel, who played a critical role in shaping the scientific evidence and basis for what USDA put forward last week. Today is the first day of a 3-month comment period where the WIC community can once again raise its collective voice to secure significant change on behalf of our participating families. With today's presentation, we're going to go through a bit of the context of how we got to this historic moment, what specifically is going to be proposed, and how we can band together to deliver on these changes and to incorporate new food packages for the 6.3 million participants across the program. Let's go to our next slide. So of course, we all know the value of the WIC food package and how it is a critical role both in delivering healthy foods to WIC participants and also serving as the carrot that brings families to WIC and our nutrition counseling in the first place. The WIC food packages have been in place since the formation of the program in 1974 and have gone through different stages over the years. However, it was the 1980 food package rules that became most associated with the program for a very long time, including the dynamics that unfortunately have exacerbated some disparities around the WIC eligible population, including around higher rates of consumption of juice. Of course, the 1980 food packages also carried some significant public health wins, including standards for iron fortification in formulas and cereal that we know contribute to WIC's efforts in decreasing iron deficiency anemia for both our population and the broader population at large. But of course, it was the 2009 food package changes that revisited for the first time the 1980 food packages and articulated a significantly different vision of what WIC should be bringing forward. With greater alignment to the dietary guidelines for Americans, the 2009 food package changes introduced the cash value benefit for fruits and vegetables, added whole grains as a distinct and separate category from cereals, and put forward different issuance patterns that shaped consumption behaviors and trends. In the years following the 2009 food package changes, researchers noted increased rates of breastfeeding initiation, increased rates of consumption of fruits, vegetables, and whole grains, increased consumption of low-fat and non-fat dairy, as well as decreased consumption of whole milk and higher-fat dairy. All of these changes put together have contributed to improved and positive health outcomes for WIC families, most significantly a 9% decrease in childhood obesity rates among WIC-enrolled toddlers. This decrease in childhood obesity rates is measured by the Centers for Disease Control and Prevention, or CDC, and demonstrates even more pronounced declines in childhood obesity among Hispanic, Indigenous, and AAPI children. And so we know that adherence to the science-based standards and alignment with the dietary guidelines can deliver improved health outcomes. And that is why it is no surprise that WIC and its successful early nutrition intervention were a core part of the National Strategy on Hunger, Nutrition, and Health, rolled out 2 months ago by President Biden at the White House conference. In addition to promising to move forward a rulemaking on the WIC food packages, the national strategy also made a commitment to seek higher values of fruits and vegetables in the food packages for time to come. And so that is certainly something we are excited to see and to move forward. Let's move to the next slide. Before I walk through the process of how we got to this moment, I want to take a moment to note the overwhelming enthusiasm on this call. We have hit our maximum capacity on Zoom. However, this call is being recorded and we will be sharing out the recording through the WIC Action Network, through Monday Update and other channels. And so please let anyone know who's trying to get in that there will be a recording shared before the end of the day. But how did we get to this moment for the WIC food packages? So the success of the 2009 Food Package Review inspired Congress to make it a requirement that USDA review the food packages every decade, particularly to evaluate the food packages in the context of nutrition science, public health concern, and cultural eating patterns. This provision in the Healthy Hunger-Free Kids Act of 2010 led USDA to once again contract with the National Academies of Sciences to conduct a review from the period of 2014 to 2017. In 2017, the National Academies of Sciences, including WIC's own Shannon Whaley, issued a 1,000-page report with key recommendations. This National Academies report was titled Improving Balance and Choice, and sought to further align WIC participant diets with the dietary guidelines, both by boosting intake of priority nutrients and encouraging more balanced consumption across critical DGA food categories. The National Academies report is our guiding light throughout this process. It is the vessel through which the dietary guidelines were evaluated through the context of program administration in WIC. And so it is a really important step that USDA follow and honor the science-based process of the National Academies. And we are glad to report that the proposed rule does in fact honor that framework. Before USDA was able to move forward the National Academy's recommendations, a new edition of the dietary guidelines went into place in 2020. The dietary guidelines were also the first edition, the 9th edition total, but the first edition to issue dietary recommendations for pregnant women, lactating women, and early childhood, the P24 guidelines. These guidelines affirmed scientific consensus and many of the recommendations coming from the World Health Organization, the American Academy of Pediatrics, and other public health experts. And most significantly, identified two shifts that underscored the importance of the National Academy's recommendations. First, a call across all dietary patterns for a lower rate of calories for other uses, such as saturated fats, sodium, and added sugars. And then secondly, a particular shout out to seafood as critical for pregnancy, lactation, and early childhood, noting seafood carries with it particular benefits that could result in improved cognitive development. So those two recommendations, while not necessarily surprising, underscored recommendations included in the National Academies. Now, all of us know that it wasn't just the dietary guidelines that changed between 2017 and now, but also the significant increases in WIC fruit and vegetable issuance associated first with the American Rescue Plan Act and then extended on a bipartisan basis by congressional appropriators. Instead of a $9 benefit per month, WIC is now able to issue $25 per month for children and up to $49 for women depending on breastfeeding status. And so this is a significant shift in WIC benefit issuance. The WIC benefit has never seen a deliberate increase in its benefits since the program was started in 1974. In fact, the average benefit in the 1970s was $20 a month across 4 food categories in the adult and child food packages. By 2021, the average benefit was only $36 per month across 8 categories in the child and adult food packages. And so we've seen that WIC families' purchasing power has diminished over time. If inflation was applied across every year, the WIC benefit of the 1970s would deliver about $100 of foods today. And so there's a huge gap in what WIC participants have been able to purchase over time. The American Rescue Plan Act and the appropriations additions to the food package and other suggested increases in the proposed rule are a substantial step forward in remedying that gap. Today marks the beginning of a 3-month comment period. So over the next couple minutes, we are going to go through the content of what USDA has put forward as a proposed rule. It is incumbent that we as a community raise our voice and over the next 3 months, communicate our thoughts, our anecdotes, our data with USDA so that they can bring it all together and issue a final rule. Only once the final rule is issued can WIC agencies begin the process of aligning their food packages with the new regulations. So let's dive in. Next slide. Let's start with fruits and vegetables. This is, of course, the marquee success of the proposed rule. The proposed rule would codify the values that are currently in place with the increases that have been in place since October 2021. This includes about $25 per month for children and between $44 to $49 per month for women. These increases will also be adjusted annually for inflation, and according to current FNS projections, the adjustment for inflation will see the value for breastfeeding women increase to at least $50 per month in 2024. This is a huge success. We've already seen a wealth of research in the last year that has demonstrated that increased values for fruits and vegetables are associated with increased purchases of fruits and vegetables, an increased variety of fruits and vegetables being purchased, and a 1/4 cup per day increase in fruit and vegetable consumption among young children. This is substantial progress in meeting the dietary guidelines recommendations in a core and underconsumed food group. Of course, the increases will also help reflect the fact that the cash value benefit is also one of the most malleable and versatile parts of the food package. It will afford participants greater choice and will honor and respect cultural eating patterns by including a greater range of produce. That also includes an addition of fresh herbs such as cilantro to the cash value benefit to reflect both the fact that it is a larger benefit and also to honor and respect cultural eating patterns and a diversity of flavors and tastes that are sought to be introduced so early. Building on WIC's history of shaping industry behaviors, the proposed rule would also put forward that a new requirement that WIC authorized vendors stock at least 3 forms of vegetables. In the 2009 food package changes, WIC authorized vendors were required to stock 2 forms of fruits, 2 forms of vegetables, and 1 whole grain cereal. These minimum stock requirements are associated with increased stocking of fruits and vegetables and fresh produce, especially in low-income neighborhoods. And so we know that the WIC standards don't only impact WIC families, but have a spillover effect on the community at large and resolve disparities, especially in low-income neighborhoods and communities of color, about access to healthy foods. Now, of course, the increases to fruits and vegetables underscore a key recommendation of the dietary guidelines with respect to having at least half of fruit intake be from whole fruit, particularly to address fiber intake. Now, WIC is in a position to flip the script on where we've been for the last several decades and to reinforce both medical messages and nutrition education messages to direct families towards whole fruit. Of course, one of the dynamics that we continue to see is the role of juice issuance in shaping participant behaviors. Under the proposed rule, USDA would essentially have juice issuance across the food packages and then allow for participants to swap out any remaining juice benefit for additional fruits and vegetables. This is the one core area where during the comment period, we would love to lift up our community voice and encourage USDA to go one step further, to eliminate default issuance from the WIC food packages and allow juice only as a substitution at participant request. And so that $3 substitution value for juice would then be transferred to the cash value benefit as additional support, and participants would only get juice at request as a substitution. This would go a long way towards aligning WIC's nutrition education messages with the foods that we offer. Next slide. Another big area of change is in protein foods and most significantly in seafood. USDA's proposed rule would take seafood, which is only issued in the fully breastfeeding category, and expand it to all adult food packages and for children aged 2 to 4. This would increase the proportion of WIC participants receiving seafood from only 3.4% to 58.7%. It's a huge shift in who is getting seafood in the program. It recognizes again the 2020 DGA's recommendation that seafood is particularly critical for the age groups served by WIC. Also recognizing that, and also including an additional food group to create a more balanced approach to food groups across the food package. This will increase early exposure to different tastes and textures, and hopefully set food preferences on a healthier path for the next generation. That number of who is receiving seafood can be even more significant, reaching into the 70% range if 1-year-old children are included. And USDA did not feel at this time that they could advise, but they put out a request for additional information on the fish types and package sizes that would be suitable to align with dietary recommendations for 1-year-old children. And so there is an opportunity for us to encourage USDA to go further if both industry and nutrition recommendations can provide suitable answers to those inquiries. A few minor changes around authorizing canned legumes in addition to dried legumes, and authorizing legumes and peanut butter and an option for tofu as an egg substitution as well. Let's go to the next slide. Whole grains is another category where we see significant progress as an attempt to address underconsumption of key food groups and nutrients across the food package. We know that whole grains are underconsumed by 100% of participating adults and 93% of participating children. And so it is a key area where WIC can help, again, flip the script of current dietary behaviors and shift WIC participant diets from refined grains to whole grains. It is also an area where WIC can once again employ its standards to encourage industry reformulation of products and innovation in this space to boost whole grain intake, not just for the WIC eligible population, but for the general shopping public. One area where WIC can leverage its standards is through requiring all cereals to meet whole grain standards and have whole grain listed as the first ingredient, as an attempt to boost intake amongst children. We certainly know that cereals, the breakfast cereal category, is one of the most significant ways that children consume whole grains in the first place. And this is an opportunity for cereals to not just be a vehicle for the current portfolio of nutrients, but also for whole grains as well. In addition, the proposed rule would boost whole grain issuance across all women categories from 1 pound to 4 pounds, to boost adult whole grain intake and to close disparities, especially for racial and ethnic groups that significantly underconsume whole grains across their comparable groups, including Hispanics and indigenous populations. In addition to boosting whole grain issuance and boosting whole grain in cereal, USDA really demonstrates that this proposed rule has listened to input and feedback from the community and added a wide range of cultural whole grain options to the food packages. This is an area where National WIC Association has been pushing for USDA to do more than the National Academies report, and USDA has listened to this input, and you see the list of additional options there on the screen, everything from quinoa and teff and buckwheat to whole wheat pita, bagels, and naan. And so this is a great step forward in increasing the cultural availability and applicability of the WIC food package. Next slide. Dairy is another area where WIC seeks to improve participant choice. Now, this is an area where we can once again see balanced issuance across the food package. And so overall dairy issuance will come down a little bit to better align dairy issuance with the other food groups. Nonetheless, dairy will still be one of the most prominent elements of the food package, with about 71% of adult DGA recommended intake being met and 59% of child DGA recommended intake being met by the new standards. In addition to the slight reductions in issuance, we would see new substitution patterns that would not only encourage an additional quart of yogurt as a substitute to fluid milk, but would remove the barriers in substitution to fluid milk to ensure that participants could redeem the 2 quarts of yogurt, tofu, and cheese without having to choose between them. And that's a key piece that we've heard from participants. It would really change the game in availability of a diversity of dairy products for WIC participants. In addition, there would be the inclusion of not just the soy beverages that exist, but soy-based yogurts and cheese as a substitute for different dietary patterns. Now, the reason why USDA felt confident in being able to allow for this broad range of substitutions is a comprehensive approach to tackle particularly added sugars in dairy and dairy substitutes. The USDA proposed rule would include total sugar limits for yogurt and soy beverages that would hopefully be seen as a way to reduce added sugars in those food categories and reduce some of the calories for other uses that would have otherwise deterred the availability of all of these dairy substitutes. Importantly, once again, reflecting participant input and the broad range of perspectives that we communicated to USDA and USDA heard in their own outreach, is the need to create a pathway to approve nutritionally comparable alternatives to dairy, including plant-based alternatives such as almond and oat milk. This is something we know our participants want, but based on the nutritional profile of many of these products, they are not yet ready to deliver the same nutrients that are provided by soy beverages and by dairy. And so this is, once again, an opportunity where the WIC standards and food package can set the standard for industry and encourage reformulation that not only benefits WIC participants, but the broader community and the availability of healthier products on the retail shelf. We encourage this pathway to be included in USDA's final rule, which would allow for industry to try and meet targets and move products to approval on WIC-approved lists before another rulemaking occurs. And so the hope is that once this rule is in place, we don't have to go through a whole nother cycle of a National Academies review and then another rulemaking process, which could be quite a long time before these products could be approved and available to WIC participants. Next slide. A really significant shift across all the food categories is also a step to address package size flexibility. This is another piece where we have heard from participants that it is difficult, it is a barrier in the shopping experience, and it has been more pronounced challenge during COVID-19. USDA would allow package and container size flexibility across all food categories except for infant formula. The National Academies report specifically cited yogurt and whole grain breads as an area where there seems to be WIC-only sizes that is both more expensive to the program and more challenging for stores to stock regularly. So to avoid this problem of WIC-only sizes, USDA would afford states the authority to authorize products at sizes that allow less than the full monthly amount. Let's take yogurt for an example, where yogurt has the 32-ounce tub, but of course has been offering multi-pack and single-serve container sizes that certainly may or may not be at that 32-ounce level. And so by providing flexibility, a broader range of products would be available, and leveraging EBT technology, it would be easy to provide those products without sacrificing benefit in a single shopping trip for a participant. There is an open question, one piece that the comment period would like to see and understand, of whether the package sizes would have to add up to the total amount of the full monthly benefit. And this is an area where, again, coming up in yogurt, the National Academies had recommended a range of 30 to 32 ounces to recognize the flexibility that is needed to accommodate potentially 6-ounce containers, smaller than 6-ounce containers, and to adapt to a changing industry as well. And so that's an area that we would love to see robust commenting on. There's also USDA is soliciting questions, and let's take cereal for an example here, where households could redeem package sizes that are greater than the monthly amount if covered by an aggregate benefit. So say both a pregnant woman and a child participant from the same household are on the program, and there is a cereal size in excess of 36 ounces, can the aggregate benefit be used to select that package size? That is certainly on the table in this USDA proposed rule. Next slide. And of course, we'd be remiss in discussing the health benefits of WIC without discussing breastfeeding and infant feeding, a critical role, although certainly the changes to the infant food packages are not as significant or robust as we see in the child and adult food packages. Nonetheless, the priority throughout these food packages is that WIC services continue to promote and support sustained breastfeeding for WIC participants. And one path that the National Academies put forward is to allow for tailored formula issuance to support breastfeeding moms in meeting their breastfeeding goals. And this is certainly a challenge that we've seen manifest at the local level after the 2009 food package changes, where we had the reverse effect of sometimes driving moms towards a higher formula food package simply because we cannot tailor formula issuance. And so that would be a flexibility that is provided with the intention and understanding that it is meant to support and buttress WIC's breastfeeding mission. Additionally, we would see reductions to infant cereal and jarred infant food issuance to reflect recommended intake levels from the dietary guidelines. And a piece that many moms have been clamoring for is a new substitution option to allow for participants to exchange half or all of their jarred infant fruits and vegetables to obtain additional cash value benefit. Unlike the National Academies, however, a substitution option was not offered by the USDA proposed rule for jarred infant meats. And one of the challenge here is that USDA is still soliciting input on 1-year-old serving size and fish types that can be allowed. And so if USDA receives adequate input during the comment period on 1-year-old fish, it is possible that a substitution option for jarred infant meats could be integrated into a final rule. So that's another piece that we'd like to see. And I know that is the least redeemed food package item, and providers have struggled to sell participants on the value of jarred infant meats, even though it is a great source of iron and zinc, which is important for that population. Next slide. So that is a summary of all of the different changes. There are more included. We do not have time to go through absolutely everything, but we hope that that is a good overview of what the proposed rule has put forward. Again, the true highlights here are the bumps to fruits and vegetables, seafood, and whole grains. Taken together, those changes alone can make a substantial difference in bringing WIC participant diets closer to the dietary guideline recommendations. In addition, there's so many opportunities, whether it be the minimum stock requirements for vegetables, the cereal standards for whole grains, or the sugar limits in dairy, that will help boost intake of key nutrients and food groups while also reducing consumption of those calories for other uses. So how do we get these food packages into place? And it will take all of us speaking together with a collective voice. The comment period opens today and ends 3 months from now on February 21st, 2023. So we have 3 months to rally the entire WIC community to communicate the importance of all of these changes. Coincidentally, February 21st, 2023 is the first day of NWA's virtual National Policy Conference, and we encourage you all to register for that so that we can unpack all of these changes after the comment period and set the path forward for WIC in the new Congress. I want to clarify that this process is not a legislative process. It is not tied up in appropriations. It is not child nutrition reauthorization. This is a rulemaking process. So it is USDA asking the community for their input as it considers rules changes. An important facet here is that means that this is not a lobbying activity. Because legislation is not involved, you can feel confident in participating in the comment period and suggesting all of your thoughts, lifting the voices of the participants in your clinic without being concerned that it is a lobbying activity. Now, who can comment? Everyone. It is a public comment period, and USDA needs to hear from folks who are connected or impacted by the program to make an informed and reasoned decision here. And so it is important that you participate in the comment period, that your colleagues in your local agency participate in the comment period, that WIC participants connect with the comment period, that you connect with community partners, your friends, your neighbors, and get them to submit a comment before February 21st. To assist you in this effort, the National WIC Association has prepared a comment platform that allows you for one-click submission to the Federal Register. Let's take a look at the comment platform, and this way you can all be familiarized with it. And we will share out both the slides and the link for this comment platform through an email after this, but also through social media and throughout different newsletters and channels over the next 3 months. On this page, you can see that we will submit comments to the WIC food package to USDA. So if we scroll down on the right, you'll see there's an opportunity to enter your comment. There's some boilerplate language there that you should take and adapt to reflect your own voice. And it summarizes many of the key pieces that we are hoping to elevate throughout the comment period. And then on the left, you'll see there's a link that says this resource. And if we click on that link, downloading now.
Whoa.
If we click on this link, it brings you to a document that provides significantly more information to help inform your comment. And so not only is this resource going to walk you through how to submit a comment and considerations about what should be included in a comment, but it includes citable information about the National Academy's report on each of the topics that we just discussed. And we will continue to update this document throughout the comment period with even more information so that you have everything at your fingertips to submit an informed comment that reflects your experience with WIC. If we go back to the comment platform and scroll down just a bit, once you fill in your comment, copy and paste it into the comment box and add some information, and then you simply click submit your comment, and then it will go straight to USDA, and you will have participated in the comment process. This platform is public. It is going to be available. So please share it with your network through all of those social media platforms, several of which I do not have a profile on, but I hope that your agencies do and that you can share it with the WIC community and get particularly participating families engaged in the process. This is, as one of the core recommendations of the national strategy, having a participant-minded comment process, one that invokes the experience of those who participate in this program and live with these decisions every day, will inform USDA about the decisions that they need to take. And so it is imperative that we lift up this platform, this information, and this opportunity to all WIC participants in the broader WIC community. And of course, if we go back to the slide deck, you will see that there are a host of us here at National WIC Association who are prepared and willing to support you in crafting your comment, in crafting messages that can reach participants, and in filling in all of the details of this very complicated proposed rule. We know that there is a lot to digest here, a lot to navigate here, but we also know that as nutritionists, we live and thrive in the details. And so it is imperative that we learn very quickly the substance of this rule and become messengers and communicators for it so that we can accomplish all of these big things that we've sought for so long, including boosted fruit and vegetable issuance, boosted seafood and whole grain intake, reducing, if not eliminating, default issuance of juice, increasing and supporting breastfeeding outcomes, and increasing flexibility and variety and cultural options across the food package. We are so excited about the next couple months, and we cannot look forward enough to realizing these changes on the ground. Now, that being said, let's try and get through a couple of the questions here. And I would ask if one of my colleagues at National WIC Association can help read out some of the questions. And then we will try and make sure that you leave this webinar equipped and ready to move forward into this comment period.
Sure, I can help with questions. We'll start with a good question from Misha. Does USDA have a way to accept comments in languages other than English?
Yes, you can submit comments through the platform. You know, and in any language, but before you do a full analysis of or a full drive to bring in comments from participants in other languages, let us just confirm that they will accept comments in languages other than English. Technically they can, but it's a matter of whether they'll read those comments.
Let's see. Is there a time frame for when these changes may be implemented?
So the proposed rule recommends that there will be an 18-month window to implement the changes, but that comes after the final rule. So when the comment period concludes in February, USDA has an undetermined amount of time to process all of the comments and to issue the final rule. It is our hope that they will act expeditiously to do so. And then after that final rule is issued, state WIC agencies would likely have 18 months to turn things around and begin issuing the new food packages.
Does this process involve Congress at all, or is it just USDA making these decisions?
USDA is in the deciding zone here, and so that is what makes it not a lobbying activity, is that USDA is the one who can make decisions. Now, of course, WIC is a discretionary program, and we want to make sure that we are able to assure funding for the program. But as many of you know, earlier this year, there was a bipartisan letter led by Senators Gillibrand of New York and Murkowski of Alaska, as well as Representative Gwen Moore of Wisconsin and the late Don Young, also of Alaska, that called for many of these changes, included boosted fruit and vegetable and seafood issuance, which signaled some degree of support from Congress for going further and investing in the WIC benefit.
Is there a limit on how many times a single person can submit a comment? I appreciate the enthusiasm.
We do appreciate the enthusiasm. We would encourage only one comment per person. Otherwise, it could cause confusion. And we certainly want to have a fair, honest, open, and transparent process here.
Is there a social media toolkit for this comment period so we can promote it on our social media channels?
Stay tuned and stay connected with the National WIC Association social media channels, and we will be sharing out a lot of materials through that, including resources for local agencies in the weeks ahead.
How long will USDA take in reviewing comments?
They do not have any requirement on how long it will take to review the comments, but we certainly hope that they work quickly to sort through them. I should note that no one should have a concern about submitting a comment because what USDA has to do after they close the comment period is group comments based on distinct ideas that are brought forward. But it doesn't hurt for them to have over 10,000 comments saying, let's do increased fruits and vegetables. That won't delay their process. And it is important in our view that they hear from both a quantity and a breadth of interested parties.
All right. For folks asking questions about specific slides, we will be sharing both the slide deck and the recording of the webinar after this. So you're welcome to go back and comb through those as much as you'd like later. Do we have the option of submitting our comments as individuals and agency-wide, or as parent agency comments?
Yes, you can do all three. So you can submit as an individual, you could submit on behalf of your local agency, and then you could get your parent agency involved. And I would encourage folks in the coming days to reach out to your parent agencies and your higher ups to get them engaged and to make them aware. This is a great opportunity for them to understand and appreciate their role in elevating WIC at the national level as well. So.
And Brian, can you explain a little bit how we expect the fruits and vegetable bump to be handled during the comment and review period?
Right, and so this is where Congress comes in, is that as it has been since April 2021, the current fruit and vegetable is a congressionally authorized rate. And so Congress can extend that. However, that extension is separate and distinct from the food package changes. Our hope is that Congress will extend the fruit and vegetable bump as a full bridge until the new food packages can be issued. And so while Congress is not necessarily the one deciding what goes in the USDA regulations, they are the ones who will decide in this interim period how the fruit and vegetable bump is handled. That fruit and vegetable bump is tied up in the current omnibus negotiations, with the omnibus needing to be decided on by December 16th. We hear renewed commitment from appropriators in the last couple weeks after the election that they would like to reach an omnibus agreement. And we have optimism that not only will an agreement be reached in December, but that it will extend the fruit and vegetable bump for the remainder of the fiscal year. But that again takes our collective voice, and that would be a lobbying activity to encourage Congress to sustain the fruit and vegetable bump. I would love to circle back to the question around the languages of comments, and I am not seeing anything in the notification that would limit the languages to English only. So please feel free to encourage folks to submit comments across languages.
Brian, do you want to shout out Salute America and UNIDOS's comment platform?
Yes, yeah. So in addition to the National WIC Association's comment platform, we are grateful that some of our partners in the Latino and Hispanic community have gotten engaged in this process and have put together a comment platform specific to the Latino and Hispanic communities. Nell will share that in the chat for UNIDOS US and Salute America, which is a health equity project at UT Austin. And so we are grateful to partner with them, and we are working with a wide range of groups here at both the national level and at the state and local level to raise awareness about the comment period and to get them engaged as well. Of course, Salute America and National WIC Association both use the same platform for our comment platforms, which I thought was a nice little touch. But feel free to elevate both. In our mind, there is no one group that controls the commenting process. It is very much a collaborative effort. We are all on the team of making sure that WIC families have their voices heard. Okay. On that note, we are so incredibly grateful for all of your hard work over the last several years to raise awareness, to educate policymakers, and to clamor for these changes that we now see proposed by USDA. This is such an exciting opportunity, such an exciting moment in WIC history, and it's up to us to carry the banner forward and get it over the finish line. And so we will be in touch several times over the next 3 months to help rally support for the food package changes. But please never hesitate to reach out to the wonderful staff here at National WIC Association. Our emails are on the screen right now. Please feel free to reach out if we can be of any support. And if we can come and speak to some groups, we'd be happy to do that to make sure that we're getting the good word out here. On that note, I think we all have a lot to be thankful for this week. And so it is wonderful to spend this time with you. And let's take this message forward through the holiday break and into December and the months ahead. Thank you, everyone.
Thank you. Well done.